Hello, everybody. Good afternoon from India. I'm Dr. Massimo Iannaccone. I'm a specialist in chiropractic and osteopathic and doctor in general medicine and a specialist in traditional Chinese medicine, acupuncture, tunology, and traditional Chinese medicine in general. So today I explain in about 45-50 minutes about KSM methodology. It's a pleasure to join in your association. Now we are in Italy, and the KSM methodology it's a methodology and including the chiropractic, osteopathic medicine, and the traditional Chinese medicine. So today we have one excursion about TMJ in combination with Chinese medicine and tunology therapy. I want to explain, we need to more time about this receptor because TMJ receptor is very important for connect and balance all the postural body. We have three receptors are very important: the eyes receptor, stomatognatic receptor, and bridge receptor. But it's very important to understand the connection of biomechanic systems because the biomechanic system it's very important about in the result about the connection with all the body, with the spine, with the arms. It's very important to understand the primary case about our therapy. So today I explain our methodology in our therapy. So it's very important when we check the patient, it's very important to know about the sacroiliac joint because the sacroiliac joint are very important for connection with cervical spine, thoracic spine, and the body. In Chinese medicine also, there are two important meridian points that connect and protect all the body. There are two important meridian points that connect to linea alba in the spine, the back spine, is important in our valuation. So today I explain about the DTM functional problems. So dysfunctional problems. So when we do the evaluation about this receptor in combination with Chinese medicine, it's very important to know about the qi. The qi and the blood are very important for connecting and for before treatment. So it's very important to understand the movement of the qi, the movement of the blood, the movement of the qi in the channel for that connect with somatognatic receptor. So it's very important to connect to evaluation about yin yang. Yang are very important in the evaluation of the diagnosis. It's very important to understand the connection with the qi, the blood, with organic system, with organics and visceral systems. It's very important to understand the transmission of the qi, including in the biomechanical system of TMJ. Because when we do a therapy, before we need to connect with qi and meridian point and the blood system and also the water. The water are very important because the water is 90% our cellula have water inside. So when we preparing the patient, we need to work in the different steps. The first steps, it's very important to check the biomechanic systems. It's very important to check the sacroiliac joint, the basic. It's very important to understand the rotation, and it's very important to understand the connection with sacroiliac joint and the cervical spine. The second, it's very, very important to understand the relationship with atlas and C1, C2, and the sacrum, and balance in the sacroiliac joint. It's very important to understand the connection with sacroiliac joint, sacrum, L5, L4, to connecting with cervical spine, C1, C2, and the movement also with the atlas and the relationship with the atlas, C1, C2, and L5, L4, and sacroiliac joint. Because this is the biomechanic. The biomechanic system is very, very important. After that, we can check the biomechanic system of TMJ and the relationship with biomechanic TMJ and the spine and sacroiliac joint. If one question: if we do a therapy and only in the TMJ, we don't check the sacroiliac joint and the biomechanic systems and movement of the sacroiliac joint, our therapy is no complete therapy, because we need to work before in the biomechanic system. The second job, it's very important to work in the functional systems. So we need to work in Chinese medicine, because Chinese medicine, it's very, very important to connect inside with outside, outside with inside. So we need to understand the movement I told you before about the chi. So we made one check of the patient. The patient come in our clinic and have a problem in the lumbar spine or have a problem in the cervical spine. For example, if the patient have a problem in the cervical spine, we check the problem if it's come from bridge receptor or eyes receptor, the dysfunction, or come from TMJ. For example, today we speak about TMJ. So we understand about TMJ movement, the biomechanic movement of TMJ. Today we don't have time to explain about the movement of TMJ in the biomechanic functional systems, but we explain one check therapy, KSM methodology in this dysfunctional system. So first we check the patient, we check the sacroiliac joint, we check L5, L4, we check the thoracic spine, we check the cervical spine, we check the head, we check the position of TMJ. After that, we check the functional system in Chinese medicine. So we check the meridian point that connect with TMJ and all the body, of course. So it's very important before we can work in the first steps, we work in the biomechanic systems. So first step, check sacroiliac joint. If there is some rotation, if there is some some position about short legs, we can check this articulation before, we check the sacrum, and we check if the patient need, we check the position of L5, L4. So we go up, we check the thoracic spine, if there is some rotation or some dysfunctional problem of the thoracic spine. After that, we fix C1, C2 first and the second C1. After that, we work in the stomatognatic receptors. So we need to know about which meridian point arrive in the stomatognatic receptor. There are three important meridian points that connect with TMJ. There are stomach meridian channel. There are gallbladder systems. So I'm preparing for you this check, because today I don't know which share the screen, but we have difficulty with Facebook to share the screen. But this is our maps, because these maps, it's very, very important for relaxing before the muscles, for move the chi and the blood in the receptors. So this is the stomach meridian. We know the meridian stomach, all the meridian stomach. Later I tell you which point we need to push in meridian point in the stomach channel. We have the connection with gallbladder channel. You see the connection with the condyle of articulation of TMJ. We have another important channel. It's very, very important also. You see the movement of gallbladder channel, because another channel, another maps are very, very important. After movement, you see the movement of the chi of the blood in the TMJ and the mandibular joint. So it's very important to work in this direction. But why we need to work in Chinese medicine direction for treatment of TMJ, dysfunctional and mandibular joint? So it's very important because mostly of you, they know the Chinese medicine effect in the human body, but mostly work only in the structural system to move the spine, move the mechanic joint, but we need to relaxing before the muscles, outside, inside. We need to do the manipulation before, but sometimes the muscles are too tight, too strong. We need to move chi, blood and water inside the muscles and inside of the temporomandibular joint articulation. It's very important. So we need to move the chi and the blood of the channel. So in our research, we work different years in the combination in the osteopathic systems, in the visceral osteopathic manipulation, in the chiropractic biomechanic combination. We have 3 medical combinations in our therapy. First, biomechanic. Second, the visceral work in the abdominal area. And another step is Chinese medicine movement of chi and blood. But it's very important to understand the combination of our therapy. So first, remember biomechanics. We understand step by step the biomechanics correction. After that, we work in the linea alba. It's very, very important ligament. This is the combination of our job in the linea alba, and including this is another important channel in our medicine. So, sorry, I asked to my assistant to bring another paper. So, it's very, very important to understand the work of this channel. Later I explain you why it's very important to understand the two important channels in our work. But the combination, so we have three kind of combination of our therapy. But, for example, if you practice before only Chinese medicine, you can have good result because you work in the functional systems. You remove the block in the channel, but if you have some problem in sacroiliac joint, or you have some dysfunctional in the spine, rotation on different movement of the spine, you move the blood in the channel, but you don't remove the biomechanic dysfunctional system. So it's very, very important you work in the correct direction. So our body move because our spine connect to the body. Our nervous systems connect in the visceral body and connect to all the spine, all the mind, the spine, the muscles. So the biomechanical system are very, very, very important. So we need to remove also before the biomechanics systems, and after we need to work in the visceral systems and the channel systems. So we have two important channels. One is REMAI. It's very, very important meridian channel. One is DUMAI. DUMAI is in the back of the spine, and REMAI is in the front. Why are very, very important in our therapy to understand the functional system, the energetic system of REMAI and DUMAI? Because REMAI connect with linea alba. Linea alba are very, very important because connect in the pelvic area, move up, and if there are some block in the REMAI point, the problem also have effect in our postural body. So we need to move the chi and open this channel. We need to work in the combination in some points of this channel, because this channel also control the balance of our head. Which bone is the balance of our head? Is hyoid bone. Hyoid bone are very, very, very important for working in our TMJ therapy. Because in the hyoid bone is like the balance. If the hyoid bone have some rotation or some dysfunctional movement, all the muscles inside move, change direction, change the postural of the head in the of the head to the atlas, the head to the axis, all body change. Also change the position in the flexion, in extension, all our body change. So, in case you need to understand the movement of Renmai and Dumai channel. For these questions, it's very important before move and work in the biomechanical systems. In the second steps, you need to work in some tension of abdominal area, in the visceral area. We need to work. If you know the Chinese medicine, you need to work also in the Chinese medicine point, in the Dantian, okay? You need to work the back, Dantian area. We need to work after that. We need to open Renmai in the central, in the yin of the body. This is the yin of the body. After that, you need to do the manipulation of linea alba. After that, you work in the postural, functional, and biomechanic systems. After that, you remove the qi, the blood, remove in the channel that connect with stomatognatic receptor. After move the qi and the blood, you need to work in the all therapy in all the body. So after you need to work in the stomach receptor, but it's very, very important to check the point, remove the qi, and work in the movement of the water, of the blood, and of course of the qi. But which techniques we use for move and open the qi, the channel? There are different techniques about twinology therapy, but about chiropractic systems in the biomechanical system, we need to move the spine in gently techniques. We need to work in high velocity, low amplitude, not too much strong. We need to move our spine in very, very little and gently movement. We don't need to move too fast, because when we need to move too fast the spine, we destroy the movement of the qi and the movement of the channel. So it's very, very important to understand our KSM philosophy in the medical correction. I explain now some type of manipulation for preserve the qi and don't destroy the meridian point and the channel when we do the manipulation. For example, I asked one of my assistants to sit in here. For example, when we work, for example, if we have the dysfunctional system of C2, C1, we need to work in the gently high velocity, low amplitude. We need to work, for example, on these techniques or in the prone techniques. We need not to work too much strong. If we work too much strong, you see the track, but you also destroy the channel, the movement of the qi in the meridian point. So, because the spine, when the range of movement of dysfunctional of the spine, it's very, 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 very little. It's not too much. When the spine have rotation, it's very, very, very small movement, some millimeter, not too much. So we need to contact the area. We need to contact the process, transverse process of the spine. We need to feel the chi of the body of the patient. We need to ask to the patient to breathe inside. One time and you connected, you see the feeling, you test the feeling, you do the biomechanical correct rotation, maybe 15 degree, 5 degree, 15 degree, depends. But it's very, very important when you do the pretension, you feel and connect in the meridian point. You feel the chi, you need to feel the chi. No, also the spine, also the muscles, but you need to feel the chi. If you need to feel the chi, after correction, when you do the correction, you see, pam, little bit range. The range at the high velocity is very, very slow, not too much impact, but high velocity. But you need to feel the chi. After correction of sacroiliac joint, L5, L4, thoracic spine, you go up, you check C2, C1, you correct before C2, correct before after C1. After that, you ask to the patient to open, you see the difference after that, and you decide to work in Chinese medicine direction. So, for example, we need to work in the stomach channel because the stomach channel have 3 points are very, very, very important to stomatognatic and system and mandibular joint. But before, we need to do the palpation outside the mandibular. You need to feel some tension of the muscles. You ask to the patient if pain to the right, to the left. After that, you feel about the muscles are tight. After palpation inside, outside, you feel the masseter muscles. So after that, you feel the point of Chinese medicine channel. You ask the patient if pain the stomach, point, intestine point, you see, ask to the patient to open, check in the articulation bone and disc to the condyle of articulation, ask the patient if pain, feel to pain. After that, you check to other sides. You check all biomechanic system about muscles, about bone. After that, you work in the mobilization of the chi in the channel for work in the move the blood and the water in this articulation. But before I tell you about the spine manipulation, you need to work in gentle direction. But also when you push it in tuinology system in Chinese medicine, you need to needles. You put the needles inside. Of course, okay, this also is a therapy. The needles inside and remove the chi also for the many problems, for the tinnitus, for others problems. But you need to work. Today we speak about only manipulation. So you need to feel before the chi. For example, pain here, have dysfunctional here. You see to move gently, open, you feel the chi, open a little bit close, okay. Now you feel the chi, and your fingers are like sword, is like needles. You need to work inside. You protect the body, the head of the patient. The patient are very relaxed. So work inside, work, 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 and you need to work, for example, in this direction. Yes. For example, you see, you work in this, in the, yeah, perfect. You see, we work like this, in this point, okay? All point you need to connect before, 1, 2, 3, 4. You need to open the energetic system, the channel point, and move the blood, the chi. After that, the muscles have inside good blood, good energy, good chi, and also the good water. So we need to work in the combination with like the maps. You see, this is our maps, because it's very, very important. Move first the condyle. The second, you need to go out to mandibular, up mandibular, and the inferior mandibular. So you need to work, and you need to work like this. You need to work like this. You need to feel and work like this. This only outside. After, we work inside. But today we explain about outside. So, first, you need to work inside gently. You need to feel the chi. When you put the needles, the doctor feels the chi of the patient. Also, it's very important when you use the fingers, you need to feel the chi. The first step, you need to touch the skin. You need to touch the point. The second, first, second, 3, you need to go in the direction of the channel, the direction of the biomechanic systems. You work inside. You feel the chi of the patient come up. After that, you move a little bit around the point and gently move and open. Okay. This manipulation, we can use our different maps. We can use the second maps also for trigeminus problem. We need to understand this map, of course, but this map is our research also. It's including, of course, the meridian point. In the second, we work after that also with check the hyoid, we check the point, we have palpation in the mandibular, we check. Before our treatment, the patient feels some pain outside, inside the TMJ muscles or other muscles. After that, after our therapy, we need to work in our 4 maps. After that, you check again the patient. The patient feels too much more comfortable about temporal mandibular up and inferior. After that, you check before the hyoid, the movement on the hyoid, and you check, I think you have a good result about the movement of hyoid. After that, you check the point of linea alba before in the REM-I, here 80%, in the REM-I 16 point, 17 point in REM-I. This point, it's very, very important for the stress, for the tension of the thoracic spine, in the back also, but especially for emotional point. In 80%, before do the therapy of TMJ energetic therapy, this point, 80% the patient have pain. But after therapy, this point open, other point open, so you check again, ask to the patient, check the patient 80%, and you know, finish pain. So you work also in the other point of Renmai. But when you do the therapy, of course, before stimulation, or in the same times that you have stimulation of this working and channel, you need to work in the other point of the channel. For example, when you work in the manipulation of meridian of the stomach, you need to work, of course, in the other point. For example, this stomach 36 are very, very, very important. Susali, this point is Susali in Chinese. It's very, very important. When you move and you work in the manipulation of TMJ, before also you can put the needles in this point, the needles in this point, the needles in the point 44 point, is 41 point, is 42, 44, are very, very important for balance the bridge receptors. The knee, also for the knee, are very, very important, this channel. But for move the energetic system are very, very important that during your manipulation, you need to have stimulation of this point, of the stomach point. Because you work in the head, but the channel start from the head and arrive in the foot, work also in the legs. So during your therapy, you have combination in the proximal and in the distal area of the meridian point. So this is an excursion of our meeting today, but I won't resume our therapy because it's very important that all of you understand what we need to understand. We need to understand that inside of the body and outside, when you do the correct relationship of outside and inside of the body, the patient have result. So I explain another one time the steps. The first steps, you need to work in the you need to check sacroiliac joint movement. You need to check posterior, anterior, the movement of a sacroiliac joint. After that, you need to check L5, L4, because also if don't pay, but you need to check the movement of biomechanic systems. In our research, 80% the problem come, the biomechanics problem, also in the TMJ reception, come from dysfunctional problem of sacroiliac joint. After that, we need to go up to check the thoracic spine, dysfunction. We go up and work in check C2, C1, because C1, C2 have relationship also with L5 and sacroiliac joint and sacrum. We need to work also to understand the movement of the sacrum, because the sacrum also it's very, very important. The sacrum is the balance. The sacrum connect with C1. So also we need to understand, of course, because if sacroiliac joint move, the sacrum in the same time sometimes move with sacroiliac. So this movement, this movement, this movement. So we need to correct also fix the sacrum, including sacroiliac joint. After that, you need to work up. After thoracic, we need to work in the correction of C2, rotation and movement of C2. After that, you need to work in the atlas, movement of the atlas, in the rotation and in the movement on this functional. After that, you need to work in Remai, Dumont channel, in Twina therapy. We need to use also the needles, no problems. You need to work with the fingers or with the needles. You open all channel, so also vessel channel, it's very, very important. After that, you check, of course, the movement of yoide. After that, you need to do the palpation of the muscles. Outside, of course, TMJ muscles inside and check. After that, you work in Chinese medicine therapy, including, of course, the movement, the visceral therapy, and the structural bone therapy. You need to remove in the gently techniques, high velocity, low amplitude. I tell you, because we need, in the medicine, are very, very important to preserve the blood, the chi, and the energy of the patient. If we destroy the energy and we destroy the channel of the patient, we need to remove again and work again. So we need to remove the humidity inside the body. We need to move sometimes the fire inside the body. So, but this is a Chinese medicine philosophy. So, especially in the up, the fire come up. The water come down. So, we need to rebalance in yang. We need to move fire little bit down, water up, and we need to move the water here. If the water arrive here in the head, in the stomatognatic receptor, the blood, the chi, remove the block. And the muscles have more energy, are more comfortable, so, and the patient feel very, very good and too much better. So, this is our approach today, because this approach, of course, need the lessons in the real time. We need the lessons and explain again the manipulation. We explain the type and the direction of the next time. Maybe we have other lessons about these techniques. Also, are more interesting to check inside and have the therapy, neatology therapy inside with KSM methodology. But today, remember, if you use other therapy, other style of manipulation, if you want to work to fascial, in the fascial manipulation, but it's very important that you work in the free directional and you use three different kinds of the medicine. First, remember biomechanics. Second, you check visceral and meridian point. You remove in the meridian point channel, humor and mind, and free, of course, you need to work in the movement of G and blood in the area that you need to work. Today we explain about TMJ, but also you need to work in which these models of therapy for lumbar pain, cervical pain, knee pain, elbow pain, all the body you need to work in these three combinations. If you work only in biomechanics system, sometimes okay, but sometimes not okay. If you work only in the visceral systems, maybe also sometimes okay, but sometimes not okay. Also for problem with the shoulder. If you work only in the functional system, like acupuncture, ontoinology, but you don't work in the mechanic system in the same times, sometimes okay, but sometimes not okay. So we need to work for have a good result. We need to work in three kind of combination in our medicine. So KSM methodology, including this philosophy of the medicine, because our body have inside a doctor. If you work for get up, this is a philosophy, the doctor inside, our patient have very, very good result. Which, in conclusion, which other techniques you can work sometimes for remove the humidity inside the body? You need also use the cupping. The cupping therapy are very, very strong, are very, very important. It's very, very important, for remove the humidity inside, for remove the bad chi, for remove the bad blood. You can use before treatment of stomatognatic problems, after structural movement, after structural, you can work also with cupping therapy. You need to work in cupping therapy, but you need to use these techniques. I show you because I cannot share the screen, but I have one image I want to share with all of you. You see, use these techniques. I hope that you can see for all system and in the metabolic, you see, these techniques, you can use 40 cups, maybe more. You need to work in before. When the patient come, this is also another solution. When the patient come in the clinic and pain, neck, back, pain, first biomechanics. I tell you another strategy of the medical therapy. You first put this, first 20 minutes, you see. After that, you can see the patient. You see have inside too much toxin, have inside too much humidity. If there is humidity inside, in the meridian point, in the organic system, in the fascia systems, if you do a therapy in the stomatognatic receptor, or the problem with neck or back, or herniation problem, if you don't remove the humidity, the patient don't have the good result in your therapy. So it's very important to have combination with Chinese medicine, chiropractic medicine, and osteopathic medicine. So thanks today, because I want to thanks to Physiomaster Association, because asked me to have a little lessons, but sorry for because I don't share some image in the screen. I use only some paper, so this is normally I prefer to share, but in Facebook it's very different to Zoom or another platform. Normally I work with Zoom. I have lessons in Zoom. So, but okay, today it's very important that you know us, you know our groups, you know it's very important because KSM methodology today is present in many countries in the world. We are in China, in Malaysia, also in India, so in Italy, in Europe. KSM methodology, the focus of our methodology work, and including the combination with chiropractic, Chinese medicine first, chiropractic and osteopathic medicine. I'm working in this direction over 25 years. I work, so for me it's a pleasure to explain our philosophy, and it's a pleasure to have connection to all of you, all the doctors, all the specialists in the world, because it's very important to work for preserve the energy and preserve our patient. Thanks for your guys, thanks for attention, and hope to see all of you in the future. And also thanks to my two doctor and assistant today, Andrea and Dario. They come now in the clinic because we have clinic now. We work also, it's a Sunday, but now after that I have another webinar in India. And so thanks again, and hope to see you all guys next time. Thank you.